Hello, I'm Tim Smith. I am a board member for the National Headache Foundation, and I'm the chair of the CAQ committee. And wanted to welcome you all to this course, and hope that wanted to express our appreciation for you joining us, and our desire that you get a lot out of this course. We hope that you will find that the content you get today will be representative of what you'll be seeing on the examination, and that this will be a good prep course for you to take part in. One of the things that we talk about when we talk about certification is it's good to have a credential, and it's good for everyone's resume. It gives you a credential that you can point to in your clinical career. But the real reason for doing a certification is to help ensure a better care delivery to patients. And I wanted to talk to you a little bit about the value of education in the migraine management. And so to do that, I wanted to share with you the results of a study that we did, because this has always been an issue with those of us who do migraine and other healthcare education programs, in that when we think about how you prove the benefit of a course, for example, we look at it and we say, okay, we'll take an exam and then we'll do a post-test, and then that's how, if people pass the post-test, then we know we were effective. So a few years ago, with some funding from the National Headache Foundation and from the Primary Care Network in Missouri, my clinic and researchers performed a study that I wanted to share with you that points to the value of education in headache management. And so what we did is we put on a program where we educated physicians, and we gave educational content in the form of a packet of information to the patients that they saw. And these were primary care physicians who provided care in a provider setting. And we gave them the concepts of the program that you can see. We gave a program that covered these concepts, which covered the impact recognition of the diagnosis of headache, the benefits of early intervention, effective prophylactic schemes, non-pharmacological management, the diagnosis and treatment of medication overuse headache, and then we went over some patient self-management techniques, including the use of headache diaries, risk factor reduction, and lifestyle modification, and so forth. And when I just want to cut quickly without belaboring the study further, is look at the results. And this is not going to be a topic on the exam, but I think it points out the reason we're here today. Because when we looked at how this program was implemented, following the program, we did baseline assessments, usually looking at questionnaires and diaries, and for the patients that enrolled, and this was there's about 285 patients that were in the study. And we followed them for a year after the program was implemented. And so after we had educated the primary care physicians, then in their practices we did assessments of patients that they saw for care of headache. And when we looked at numbers of headache, you can see that the numbers trended downward and were basically cut in half over a period of 12 months. The pain severity was decreased to a statistically significant viewpoint. I'll call out to your attention those p-values of 0.0001, very dramatic. The scores on the headache impact test, and for those of you who are not familiar with this test, below 60 is a sign of good control, and the average for this population was 62.4 at baseline, and dropped below 60 and was still continuing to trend downward after 12 months post-program. Likewise, for days missed out of the office, their patients were averaging 2 per month, or a total of 6 per quarter, and that was basically cut in half after this program was implemented. When we looked at satisfaction, we basically tripled the satisfaction scores over a year. And very importantly, we reduced the emergency room utilization. And this slide shows that we had at baseline 24 patients who accounted for 38 emergency room visits over a 3-month period. And in the last quarter of the 12-month study, this number was reduced to 11 patients who accounted for only 13 emergency room visits. So basically, we reduced the emergency room use to about a third of what it was at baseline. And this slide shows that migraine-specific quality of life scores were improved in all 3 domains throughout the life of the study. And this was sustained. And we did an economic analysis, and basically what we came up with was that the calculated lost wages saved per patient in this program was over $1,500 a year, and the increase in economic productivity was about almost $3,500 per year per patient. And if you generalize that out over the entire population of the St. Louis area, we think that the impact of a program implemented broadly, an education program implemented broadly, could improve economic impact in the St. Louis area by as much as $200 million. So in conclusion, we say that this study shows that a focused migraine education program can be effective in improving outcomes, and we also showed that patients who receive education packets tend to have better outcomes. And in a post hoc analysis that we did, when we looked at the factors of this, the main drivers of the outcomes of this study were that patients had decreased worry and also an improvement in their what we call self-efficacy, which is a sense that they are in charge of their own headaches and can handle them themselves. And those two factors tended to drive the outcomes in the study much more than any specific medication or any specific intervention that was provided. Not that they weren't impactful, but the thing that improved the care the most was the direct results of the educational content. So that's why we do these programs. That's why we think a certification in headache management is a wise thing to do. I thank you all for joining us today, for signing up for this course, and wish you the best of luck on the exam and your careers. Thank you.